Enhance. Enhance increases your energy level, boosts your stamina, and increases your endurance.
You can get your Enhance at Southwell, VA4, Restorer Pharmacy, Soufre, Knights Med, Miku, Lay by Bar, The Morn, Dexter's Place, Jeremy Street, Castries, Citygate Bar, The City opposite the market, Plants Place, Denry Highway, Arlette Supermarket, Soufre, The Release Stress Bar, Labrie Highway, Cool Joint Bar, Victoria Schwazel, Prios Bus Stop 22, next to the Moshi Bus Stop, opposite the Grosile Bus Stop, Prios Bar and Grill in Corinth, Grosile.
Enhance. The best.
Public Health Insider with, of course, the Ministry of Health, Wellness and Elderly Affairs under the Department of Universal Health Coverage. Today, we will be speaking about breast cancer screening. Oh, what's up with me today? Breast cancer screening and mammography services. And with me, I have, of course, Sienna Regis. Sienna Regis is the radiology manager at the OKEU Hospital. And of course, she's the perfect person to speak to us about this new service under UHC. Because of course, you have to go to UHC, SJH or OKEU for that service. But first, as you know, with all of the services under UHC, you must first go to your wellness center. You go to your wellness center, you present your ID, and then you will be referred over to either the Owen King EU Hospital or the St. Jude Hospital for the breast cancer screening and mammography services. So welcome to the show.
Thank you, Jade, for having me.
Okay.
I'm happy and excited to be here.
Great. And I know you're very passionate about this. I recall a few months ago when we had that training exercise for the machines with the service providers and with the healthcare professionals. And you spoke so passionately about the need or the timely intervention for these 3D machines. So tell us a bit about the service itself.
Okay, so mammography is basically taking an x-ray of your breast. It is used to diagnose breast cancer and other breast issues. Mm-hmm. It is a simple and easy examination. You come in, we take at least 20 minutes to do the examination. Your breast goes between two flat plates and we compress. Mm-hmm. Most people will say it's mild discomfort, and the discomfort is not for very long. Less than 20 minutes, you're done. Early detection is key, and that's why I'm so excited that we have that machine, because as you know, the number one cancer for women in St. Lucia is breast cancer. We may not hear about it all the time, but we have a lot of women that do have breast cancer, and sometimes they come too late. So for me today is to encourage people to come in early. Early detection is the best cure. So if you get a little lentil size node in your breast, it's better you go to your doctor instantly. Do not wait for when you get a mango size for you to say you come in now, because that is late. So the treatment you get for the lentil size will be different to what you get for a bigger lump. So they have two types of mammograms that you can do. We have the general screening, where you just come in for your routine check. You don't have any symptoms, no lump, anything. Right. And there's also the diagnostic, mm-hmm. where you come in because you felt a lump or you have some kind of thing going on with your breast. Mm-hmm. And like I said before, and I'll keep on stressing, early detection is the best cure. At OKEU and St. Jude's, we have this new service where we are able to do mammograms for everyone. And under the UHC, Universal Health Care, you get this service for free. All you have to do, like Jade said before, is go to the health centers, Betty Wells, GIPC, wherever your community is, you go there, right. And you go see the doctor with your ID and you get your form. You must have the request form. and you come to OKEU or St. Jude's and you get your test done. And the good thing about that is that the report is prepared within 24 to 48 hours.
Okay.
So you do not have a long time to wait for your report. Once your report is ready, we email it to your doctor, or we call you for your reports.
Okay. Now, we really pride ourselves on transparency. And the truth is, with all of the services that we've launched under universal health coverage, we find that there's a little apprehension from women as it pertains to going in for the breast cancer screening mammography service. And to us, it is very concerning because, of course, you know that breast cancer is one of the main killers of women in St. Lucia. So what is it that you believe? Why are they scared? Is it the lack of information? What do we do at this point to ensure that more women come forward?
Okay, so I think that some of us might be afraid to come in to find out if we do or if we don't have. But I want to tell them, the same way we do our yearly pap smear, we're supposed to do our mammograms just to make sure that we don't have any cancers. I think also we might have to do some more education. Maybe go to the different health centers, even the different business places. Because I had a business place call and said they want me to come in to talk to the ladies because some of them don't want to do it, I think, because of fear. And sometimes what they hear from other people saying that it's so painful and they don't like it, but you have to get your own experience. And if you love yourself and you love your family, you love your children, your grandchildren, you will come and have your mammogram done.
I would assume that a moment of discomfort should not mean that, hey, I'm not going to go in. Is it really that painful? Let's talk a bit about that.
Well, I only can tell you for OKEU.
Yes.
With our new machine, it is not painful. I have done more than 50 patients during the training session, and they've all said the pain is nothing compared to what they've experienced before. Because the machines, every year you get new machines. This is every time you get a new vehicle or a new phone,
yes,
the standards
there's an
increase
upgrade.
and there's an upgrade.
Yes.
So this machine, the compression pad and everything it's really sweet. I have no complaints. I have not had any complaints from any of the patients that I've done. And everybody satisfied, and they've even told other people about it. So I think, come in, ladies, try out the machine. Let's get the results in. Let's get the statistics in for St. Lucia. Let's ensure that everybody within the age 40 and above come in. And remember, it's free.
Yes.
And you get a report.
Yes.
And at the end of the day, you know for sure, well, I don't have breast cancer. I can live a normal life.
Exactly.
Instead of being fearful and not coming into it, it's better to know now than not know and then you die of cancer.
And not know
Yes.
at all. And then the service, of course, includes the mammogram, your follow-up ultrasound,
Yes.
biopsy, processing of biopsy leading to diagnosis, all at no cost. All at no cost.
Yes.
So imagine, like before, how much would a mammogram
So
cost?
a mammogram is normally $150.
Right.
Then you have to do the biopsy, which might be $350 or $600, depends on where you do it.
Right.
And then if you need an ultrasound, it's $100.
Okay.
Yes.
Okay.
So once you do the mammogram, for example, you do the mammogram and the radiologist realize that you have something. He might say, okay, so let's follow up with an ultrasound. Then if he decide, he say, okay, so I suspect there is something that we need to biopsy. So we're not doing everything one time. Based on the experts, who is the radiologist, he will say, well, I need the ultrasound as a supplementary modality with the mammo.
Right.
And from there, the surgeon will decide, well, let's biopsy to make sure it's nothing. So all this is done at no cost. All these services are available at OKEU as well as St. Jude's Hospital in the south. So if you're in the south, you go to St. Jude's. If you're in the north, you come up to OKEU.
You come up to OKEU. Okay. So with women who would ask, why above 40 to 70, I believe it is?
Yeah.
Why that age group and not younger?
Okay, so based on the guidelines, it's 40 and above. So your breast at that age is less dense. At that age, most people already had children, and so it's better to do it within that time. However, you have people younger that have breast cancer that will have to do it earlier. Like I say, that's the guidelines. But if you're 30, you're 21, and you feel there's a lump in your breast, don't just sit down and say, oh, the guideline says 40. No. You go to your doctor and let your doctor guide you along the process. You don't want to just take it in your hand and say, okay, I heard Jade said, and her person said 40 and above. No, I want you to go to the doctor. Even though you're 20, even though you're 30, go back to the doctor and ask them, what's the way forward? Because I have seen people 21 years with breast cancer.
Okay.
Yeah.
Okay. And that is something that is just really, it really strikes a chord with a lot of people. And I know that many of you listening, many of you watching, many of you on our Facebook channel as well, you know somebody who has been affected with not just cancer but breast cancer. It has become so common. It has become this thing that affects most families, friend groups, colleagues. So if in the event that you would require more information on this service, of course you can reach out to the Owen King EU Hospital, the St. Jude Hospital, and of course universal health coverage. We do have all of the information that you need. I don't know how else to stress the importance of this, and it comes at no cost to you. You just heard Ms. Ray just indicate that the different prices. It would have been $600 for the biopsy, it would have been $150 for the mammogram, but right now you can get all of these services at no cost to you. So there really is no other excuse, I would say, to put your health first, take care of your health. It is very important. It is very important to us. What are some of the things, like how does one prepare for a mammogram?
Okay, so once you've gone to the doctor and you have your request form with your coupon attached to it, 5 days before and 5 days after your period, we don't recommend you do it because that time you're very sensitive.
Okay.
When you come in on the morning, if you have medication, you take your medication, you have your breakfast. The only thing we don't recommend is that you put the deodorant underneath your arm, because most of the deodorant that we use have aluminum.
Okay.
So that might be a speck that might highlight. So we ask you don't put it, but you can walk with it. We also recommend that you put a two-piece outfit, for example, a shirt and a pants, or a skirt and a blouse, because you will have to remove your top. I recommend that you leave all your jewelry at home because you will be doing different positioning. But that's just basic. That's the only thing that you need to do. No fasting, anything. You have your breakfast, you take your medication, and you come in.
Okay, this is very interesting. So when you do come in, your first point of call, or the first person that you would interact with would be home?
Will be the receptionist, and then you go in with the radiographer.
Okay.
Who will ask you questions. We have a question sheet asking you about your family history, if you have had a mammogram done before, where you had it. So if anything, we could look at your past history, your past mammo, to see what you had before and what it is now. So it's very important that you work with your previous mammo results or your previous ultrasound reports. Okay. Yeah.
Now, let's speak a bit about yourself. I mean, you are the radiology director, so you would be the first person or one of the first people who would have this information. When we sit here and we say, hey, cancer kills and breast cancer is very prevalent, but you are right there and you would have that experience. Tell us a bit about your history in this profession and how it has been in terms of the issue that we're having nationwide with breast cancer.
Okay, so I've been here for quite some time, like almost 30 years in the radiology department.
Oh, wow,
yeah.
okay.
So over the years, I've seen there have been an increase with breast cancer, and sometimes people can't afford to go and have the mammogram done. So that's why I am excited that we have this service where everybody, no matter your age, your status, where you're from, that everybody could utilize it. Because I have seen people come in. I saw a lady when she came in, her breast was almost gangrenous with cancer. Because sometimes they don't, us already, we like to say we'll do our home remedy.
Yes.
It's okay to do your home remedy, but also, please contact your physician. Because you see, they'll tell you they rub it here, this neighbor tell them drink that. It's okay to do all these things, but I prefer if you would come in and get checked up to make sure that it's not cancer. Because by the time you get to us, it's not only breast cancer you might have, but you might have mets in your lungs and other places. Because even though you have it in your breast, it travels to other parts of the body as well, based on the aggressiveness of it. So one person might have a cancer that might just be localized in the breast only,
Right.
but somebody might have an aggressive cancer, and it might be all in the liver, and we don't know that. So the earlier, the better. I know of success stories where people live after they've been diagnosed with cancer and they get the treatment. They live after 20, 30, 40 years. So early detection is key. But one thing, once you know you have cancer, for example, you definitely have to change your life. You cannot live a normal life where you drink alcohol, you smoke, you don't exercise, you don't change your eating habits. So you must have a lifestyle change. And even though you don't have cancer, I recommend that women actually do have a lifestyle change where they change what they eat, ensure that they exercise. We have no excuse now why we should not exercise. You have YouTube that give you all free videos. You have all different gyms in St. Lucia now. The gyms open 24 hours, so I see no reason why somebody might say, Oceana, you have time. You have to make time for yourself.
Yes.
So if you don't make time for yourself, who will make time for you? The day are 24 hours, not 10 hours.
Right.
So a lot of us think, well, I don't have the time, I'm busy. But if you are diagnosed with cancer, you have to make the time to get the treatment, because we don't know what kind of cancer you'll get. It might be an aggressive one. It might be one that's just a simple one that could be treated. So I think mentally we have to prepare ourselves for the best. Treat ourselves like we love it.
Yeah.
And I think normally women are more aggressive in terms of getting treatment than men. So I'm expecting within the next couple of months that we will get more patients, more women coming to OKEU and St. Jude's to get their tests done. I think so. I strongly believe that. So what we have to do, I think, Jade, is to do some more educating. Maybe going to the different workplaces, maybe having more talk shows.
Yes.
Maybe more advertisements. But I think the women will come. This week I did have a couple of them.
Okay.
Yes.
Okay.
So eventually, and I noticed we have older people coming too. So I think it's just educating the public. I mean, you'll be the master at that.
Yes.
What do we do from here to get more clients available, educated on the services we have at OKEU and St. Jude's?
What level of support does the hospital give after a diagnosis?
Okay, so if you diagnose, what they will do, they refer you to the surgeon, and then the surgeon and the oncology will work together.
Okay.
To ensure that whatever cancer, because remember they have to know what kind of cancer you have before they start the treatment. There's also what do they call them? You have phases of cancer. So we have some supports that we can go to. I know these, for example, I know phases of cancer actually help patients with cancer, and I know different workplaces actually help the staff as well.
Would you recommend that once a woman is diagnosed, or a man, it could be a man as well?
1% of men have breast cancer.
They say that we forget about the men often.
No,
Dravid likes to say that, but 1% of men. So I hope that Dravid and Jaquan and Nigel go get your mammogram. You laughing? But what I was asking, would you recommend counseling? Would you?
Yes.
That psychological intervention?
Yes,
there?
they do actually.
Yes.
At the hospital we have our psychologists. So if you diagnose with breast cancer or any other disease, they actually refer you to the psychologist.
Okay.
So that's very important. Also, for example, if you have your children, your husband, these people need counseling, because sometimes people don't know how to deal with these diseases, and they get frantic and things go helter-skelter. So counseling is very, very important. And also support from our community. So you know, maybe your neighbor is not well, she have cancer, check on her. Would you like a meal? Do you want me to drop you at the hospital? Little things like that count, because the person feel like, okay, so I have somebody to help me. Do you want me to drop your kids for you? So people have to get together and work together. I mean, now life has changed in St. Lucia, it's different, but the community is very, very important. Yeah.
So I know you touched on lifestyle changes, but what are some of the risk factors that would increase somebody's chance of getting cancer?
Okay, so the risk factors include, but not limited to them. I'm just giving you a few.
Sure.
Your family background. If you're a BRCA1, BRCA2, if your mother had it before, your sister had it, that means you have to be serious about getting checked. Obesity, smoking, alcohol, lack of activity.
So when you say alcohol,
excessive use of.
Excessive use
okay. Excessive use of alcohol.
Yes.
Because whereas you and I may just be doing it once in a while,
exactly.
there are people that actually
every day.
Yes.
Yeah.
Yes, birth control. That's one of the risk factors.
Birth control.
Yes.
Okay.
Late menstruation.
Oh.
Early menstruation, late menopause. If you never had no children. If
Really?
not breastfeeding after you have a baby. So that's based on the guidelines. That's what I know that. But maybe they have other factors. But these are the main ones.
Okay.
Lack of activity. I'm not sure if I said that before. So these are some of the risk factors we have to look into.
Okay. What if someone had polycystic ovarian syndrome? Does that increase their?
Not necessarily, but it can.
Because it's a different.
Yes, yeah.
So would it increase then maybe polycystic?
Not necessarily.
No. Okay. Because I see a lot of young women they have that PCOS.
Yeah, I know
many. So that would be one of the questions that we would have to answer. Are 3D mammograms or ultrasounds? Well, they are available.
Yeah.
So what would be the difference between the 3D and what obtained before?
Okay, so the 3D is this that you get more information.
Okay.
The depth.
Okay.
And the 2D is like normal. So based on what the doctor looking for, he will tell you that he wants 3D.
Okay, I see. So I would assume that with the assistance of the World Bank and us receiving those two machines, it has really propelled the healthcare.
Yeah, definitely.
Okay.
I mean, and now people have more choices. And remember, we have different levels of patients.
Yes.
So some people might not be able to afford to go out there. And we have those people that can't afford, the less vulnerable, that will need the services as well. So they can come to OKU, St. Jude's. So I think it's an excellent gesture, very important one for our ladies and men, the 1% of men that have breast cancer as well. And I'm pleading with everybody to come out and use the services.
Yes.
Don't be afraid. If you're afraid, speak to your doctor. The doctor will guide you. That I know for sure, because most of the doctors from the health centers, GIPC, they were trained on listening to your clinical history when you need the mammo. So I think it's something that we should use, and don't be afraid.
So what would your message be to, I know we mentioned about that psychological intervention, counseling, therapy for patients and their families, but what advice would you have for the family in ways of supporting somebody who has been affected with the disease?
To me, if I have a family member that has, for example, breast cancer, I would support them, being there for them. Ensure that they're taken care of. Because sometimes when the patient has cancer, it's like they feel like the world is ending for them. Be part of the process. Go to the doctor with them. Take them to shopping. Help them. Just be there. Because I have a family, well, it's not really direct family, that had breast cancer. And we were all there for her. Just being there for that person during that season.
Yes.
Because it's a season. Is important. Don't just put them in a corner, no.
Right.
Make them feel that they're loved. Just a little pat on the shoulder, you okay? Or just a little call. How are you feeling today? How was your appointment with your doctor?
Yes.
Because sometimes when, for example, a husband and a wife, or the wife have cancer, you feel like the husband sometimes might withdraw from the wife.
Okay.
But that's not the time for that. You need to be closer to your wife, closer to your mother, your sister, and embrace them. Make them feel that they're loved and they're wanted. You don't want them to die. Cancer should not kill anybody once it's detected early and you get the right treatment.
So in terms of, would you have information in terms of the treatments and success stories?
Well, I don't have it, but I'm sure Dr.
can get that.
Gabriel
Yes.
can give you that information. But I have heard of success stories.
He came on the show 2 weeks ago, and he did indicate that once it is early, the early detection really matters. So if once that happens, then the patient would have a higher success rate. I do believe that those figures, specific figures, is what we need to put out as well, so that people understand that it's not a death sentence unnecessarily. So maybe that would entice them to come forward and really be part of it, and to just put your health first and take care of yourself.
That's right.
As we close, Ms. Regis, from your perspective, what would be your message to women of St. Lucia, women who have not accessed this free service, this service that comes at no cost to them?
What I want to tell the women here today is that remember, early detection is a must. Early detection is the best thing you can give yourself. Come in, have your mammograms done the same way you're doing your pap smear yearly. Come in and do at least your first one. So you know, well, fine, this year I did my first mammo and I'm fine. So thereafter, every 2 years or every 1 year, you just come in again. Come in and make yourself happy, feel comfortable to do the mammo. I did my first one at the age of 49. It was not difficult, it was not painful. So right now, I just want everybody to know that early detection is the best care you can give yourself.
Thank you so much. Now, ladies and gentlemen, you've heard from Ms. Sienna Regis, who is the radiology director over at the Owen King EU Hospital. She sat with us today to give us more insight on how the machines work and what to expect when you come in for your mammogram, what to expect from the machines in terms of pain level, which she clearly indicated that it's little to none in terms of discomfort. We have 2 new state-of-the-art machines, 3D mammography machines at the Owen King EU Hospital and also at the St. Jude Hospital. In order to access the breast cancer screening and mammography services, you must first go to your local wellness center. It starts there within your hometown or community. You go to your wellness center and you carry your ID. When you do that, you will be referred to whether it be cervical cancer screening, if you are pregnant and you would like to have your labs done and your ultrasounds done, if you are male and you want to access the men's health clinic and you want to do the PSA level checks for prostate cancer, or of course if you want to come in and have your mammogram and breast cancer screening done. It starts at the wellness center. This is where universal health coverage begins. We are ensuring that we strengthen the healthcare system, and in order to do so, we must strengthen the services at the primary health institutions, which will be your local wellness center. So whatever community you live in, I am pretty sure that there is a wellness center close to you. If the wellness center that you are accessing does not offer the service of cervical cancer screening, or whether it be maternal and child health screening, you will be referred to another wellness center within your region. So it may not be within your same community, but you can go to another part of the region. That is for maternal and child health services, cervical cancer screening, as well as prostate screening. But when it comes to the mammography services, your local health provider at the wellness center, your community wellness center, will then refer you to the Owen King EU Hospital or the St. Jude Hospital, depending on where you live. When you go to the Owen King EU Hospital, you must ensure that you come to the visit with no deodorant on, as Mr. Regis indicated. It contains, much of them contain aluminum, so we do not want to interfere with the service that you would be receiving. And of course, wear loose clothing, two-piece clothing, so that they can have easy access to the breasts. It takes about 20 minutes, you said?
20 minutes.
20 minutes, just 20 minutes to find out the status of your health. So we are calling on the ladies of St. Lucia to take your health seriously, to take that first step and go to your local wellness center with your ID card. They will then refer you to the Owen King EU Hospital or the St. Jude Hospital. This is a new service under universal health coverage, where you will have your breast cancer screening, the mammography that comes at no cost, the biopsy if needed comes at no cost, and the ultrasound comes at no cost, the follow-up appointment comes at no cost. So there is nothing, you will not be required to spend any monies during that process at all, and that is through universal health coverage. This has been Public Health Insider. We will be coming out, and when I say we, I mean the team UHC. We will be coming out into the communities. You may very well see Ms. Regis if you have more questions. You may very well see Dr. Gabriel or Dr. Alicia Eugene Ford. Will have more information, or any of us on the UHC team on this particular service. And if you are a workplace with many women or few women, it doesn't matter, an entity, and you would like for us to come to you to conduct a sensitization exercise on this or any of the services under universal health coverage, please contact us through the Ministry of Health, Wellness and Elderly Affairs, and we will be glad to do so. This has been Public Health Insider. I am Jade Brown. We will be back next week. Those of you who did not tune in last week to Public Health Insider, where we spoke about the dialysis unit, the new dialysis wing that will have 16 beds at the new St. Jude Hospital. You can go ahead to the Ministry of Health's YouTube page, or go to the Universal Health Coverage YouTube Facebook page, where we have posted that interview with Dr. Adelaide Mooney, who is the medical director over at the St. Jude Hospital. So it is a 20-minute interview. You have all the information you need on kidney disease, renal failure, and of course the new dialysis wing at the St. Jude Hospital, as we prepare to transition over from the George Odlum Stadium over to the new hospital. So we're very pleased, very excited about what's coming, and next week we'll be discussing St. Jude Hospital once again. Thank you for joining PHI. See you again next week.
It is well known that diseases like diabetes, high blood pressure, and other illnesses